So, hi everyone. Welcome to the Plastic Surgery Perspective. I am Ebony, and this is,
Nurse Fonda.
and then we also have Doctor.
Dee Dee in the building. Hey guys.
Yes, hey,
Hey,
girl.
welcome.
Thank you for having me,
Yes.
ladies.
Thank you so much for coming and being with us today.
Yeah.
We know your
Absolutely.
Saturdays are probably dedicated to other things. We
Rest and
appreciate
sleep.
you. Right.
Mostly. Self-care Saturdays.
Okay. So, the first things first, where are you located?
Well, thank you for asking me. So my practice, Bodies by Dr. Dee Dee, is located in the heart of Buckhead, Atlanta, off of Peachtree, 2045 Peachtree Street, right in the hospital center. I like to call it by Piedmont Hospital over there.
Oh, yeah.
By Houston's. Most people know that
Oh,
location.
yeah.
But yeah, we're right in Atlanta, centrally located.
Awesome. So tell us a little bit about your educational background.
Absolutely. So as you can see, I'm a Bison, HU, you know.
Okay.
I trained there for medical school. Actually went there for undergrad.
Okay.
And I left there. I did my master's at Emory. Came back to Atlanta for a little bit where that's my home.
Mm-hmm.
Went back to DC for medical school and surgical residency. So I like to call myself a lifer in the HU family when you go to multiple schools in that same university. And then from there, I did my fellowship at NYU. And yeah, so
Okay.
mostly East Coast up top.
Okay. But you was born and raised here?
I was. Well, no,
Awesome.
let me take it back.
Okay.
I was born in California,
Okay.
but
Oh,
I grew
okay.
up in Atlanta, Southwest
Oh,
Atlanta.
really?
Mhm.
Wow. Okay. Awesome.
Yeah.
That's good to know.
Yeah,
A lot of
absolutely.
people like to keep it local, you know.
Yeah, so
Yeah,
Georgia Peach
mhm.
right here.
Okay.
Okay. Georgia Peach handing
We
out
in there.
peaches.
Yes, we making peaches. Yes, I love that. Can I use that?
Yeah. That was
That was a good one.
But yeah, I moved back to Atlanta around 2021. The post-COVID, Atlanta was still open air, and
good, right? Most definitely.
it was
We were
different.
outside.
It was we're outside.
Yeah.
And I kind of switched from full hospital life to this aesthetic world, and I have not looked back since.
Okay, what was your specialty?
So actually, I was in weight loss surgery, robotic minimally invasive. So I was doing that, my 600-pound life, bariatric life.
Yes.
Great. I love making patients happy. Still, a lot more dramatic results in that
Right,
aspect. But a
right.
lot of my patients were still doing the cosmetic skin procedures afterwards. So I've always had a interest, I would say, in the cosmetic world. I've always enjoyed plastic surgery. It was just that was just my focus, my passion from training, and I had great mentorship in that. And I was introduced into the med spa world a few years ago, and I saw the lifestyle change for me was a lot different from 100 hours a week, being on call, especially as a specialist. You really have no life,
Right.
right? To, I make my own schedule. I'm home. I just did a whole surgery, and I'm home by noon, and I can go to my Pilates and yoga class and really enjoy weekends and plan ahead and have really just an elective schedule. And that was very important for me at this point.
Work-life balance.
Absolutely.
Yes.
Absolutely.
Yeah.
And
Then-
still making patients happy.
Because we all know, being in that hospital setting, there is no work-life balance.
There is.
No.
It's unfortunate.
It is.
All right. So you already told us where you're located. So what procedures and services do you offer?
So I personally focus just on body sculpting. So I do lipo body sculpting. What does that mean? It is liposuction. We are not freezing the fat. We are not shifting it. I am surgically removing the fat with the latest in surgical technologies. There's a lot of terms out there, and I like that you guys are doing this because I like to talk about what's out there and what is really offered with good results. Liposuction, hands down, has the best results when we're talking about body sculpting. Surgically removing fat, it's permanently removed, okay? Now, the technique I use is called micro air. PALS, power assisted liposuction. With that, ultrasonic vibration helps remove the fat from the surrounding tissue so there's less bleeding, less bruising. There's also collagen stimulation from the inside out. So that's why a lot of my patients look like they had tummy tucks and things like that, even the bigger patients with more skin hanging. But that skin retraction really comes in because of that ultrasonic vibration and collagen production. So we're able to avoid the big incisions across the bellies, the transposition of the belly buttons, and healing time is a lot quicker, obviously. We went from weeks
Right, most
to
definitely.
a few days,
Okay.
right? And you guys see this all the time. Now, some patients, obviously, their recovery is a little bit different We'll get into that later. But for the most part,
Yeah, most definitely.
you know, you're really getting real results. And we're targeting pretty much almost from your chin, neck, 360 is the most popular, right? All around the belly, the back, the thighs, the arms, and we really do target those areas in my practice. I also have a collaborative with the Atlanta Face Company. That is a wonderful, wonderful, wonderful med spa that I'm the medical director of, but these guys offer amazing, amazing services. Everything from just your massages to hormone replacement, medical weight loss. We do it all, aesthetic injections. I have amazing nurse practitioners there, amazing nurses, therapists there, and they do everything. Facials, estheticians are in-house. So we have 2 locations there. One is also at our Buckhead location, and the other is located in Stockbridge. So if you can't get to the city, we got you on the south side.
Let me just say this. I'm so proud of you.
Yes.
It is awesome.
It's
I'm proud of
amazing.
you.
And your
That
work
is
is
good.
very good.
Okay.
Thank you. I
Yes.
try.
The girls love Dr. Didi.
Yes.
People
I
love,
try.
people
Yes.
really love you. That is awesome.
Thank
So
you.
one of the things you talked about Lipo 360. Now, here's the big thing in the surgical world,
Mhm.
doing it awake. Talk to us about that.
That's
a
scary,
big thing.
right?
Right.
That's so after we figure out what liposuction is, the next question, how do we do it awake, right?
Right.
Knock me out.
Right.
Well, let me tell you something. Anesthesia is its own surgery procedure, its own procedure, I should say, and it has its own risk. Nothing in this world is without risk.
Right.
Absolutely.
Whether you're taking a Tylenol or getting a tooth pulled or having open heart surgery, risks are involved. So when you have anesthesia, and that really means when you're put to sleep, they put a tube down your throat, your airway, right? You're given IVs, you're giving more medications. A machine is actually breathing for you, meaning you're not going to expand your lungs the same way you would if you were awake. So you have to do a lot more recovery. And anyone who's had surgery knows about the incentive spirometer, going to the PACU.
Yes.
And you also have to be MPO, meaning you can't eat anything from midnight until your procedure because you don't want anything in your tummy because you can aspirate and throw up and it can go into your airway and get pneumonia. So list goes on and on. You may not wake back up.
Right.
All these fun things, right?
Most definitely. Big risk.
So one of the things we are able to do are, and this is any procedure, you could do it without putting someone to sleep. That's just the trend of medicine in general. So once I saw that you were able to do these procedures awake, that's one of the main things also that signed me up to this world. When I was training 20, and I look young, 20 plus years ago.
Yes, you do.
You do.
When I first saw these procedures being done, we were training in the OR. People were staying in the hospital. We were manually sucking. You know, you couldn't move. You were stuck to the procedure. So we really focused just on the front. So you didn't get that full 360 effect. And, you know, we got the fat out. It worked, but the results weren't the same, right?
Correct.
When you are awake, meaning you're not awake like we're awake right now talking, you're given medication, so you're in a more of a twilight. Imagine you're getting a dental procedure. So some people, and most of my patients are actually talking. They're not asleep. Some people do fall asleep, and that's okay. But when you're not put to sleep with a machine, you're able to, number one, have a quicker recovery, meaning waking up from the procedure. We don't have as many medications. You can actually eat. I like my patients to actually eat something in the morning because we are going to give you medications. And you're going to be probably hungry later that day, and you're not going to feel like cooking dinner or, you know, eating. You want to rest. So I do want you to have something in your tummy the day of your procedure. Another thing is you're not stuck to a machine. So you're able to move, and that's how we really get that 360 effect. At one point, you're on your back. The next point, you're on your side, and it's my technique, not everybody. At one point, you're on your stomach. I've lipo people standing up, sitting up, make sure you're even to hit any areas that may be difficult. And with the assistance of my patients, because they're not fully asleep attached to the machine, I'm able to really manipulate them throughout the procedure. I may touch up a BBL with the patient standing up. That's how comfortable my patients are. And I take very, very good pride in my pain regimen, which I have worked on for 3 years now to get it, you know, to where patients are like, I know I had surgery. Was I laughing? I mean, laughing, relax. We listen to music. We have a good time. There is some amnesia effects in it. And I tell, if I could make it pain-free, I would have a Nobel Peace Prize. Like, if I could do that, there's never going to be a pain-free procedure, but you're tolerating it well, meaning you're relaxed, you're comfortable, you're tolerating the procedure for about 3-4+ hours. You walk out of there. We do roll you out, but if you wanted to, you could walk out of there. That's the goal with the Twilight surgical procedure.
Okay. That is awesome.
That is.
Thank you.
But you're right, a lot of people are just scared of doing it awake.
And if you,
know,
weren't
just-
scared,
yeah.
that would be making me scared
Oh,
because it's
that is
surgery.
true.
It's still surgery.
It's
That
still
is true.
surgery.
But it's one of the things to take risk away. And it's something that may not be for everyone. Some people may prefer to go to sleep, and that's okay.
You ever had anyone that you're like, yeah, this probably wasn't the best idea for you?
Of course.
Now you
Sat
know.
Last week. No, she was funny. We always say what happens in Dr. Dee Dee's room stays in Dr. Dee Dee's room. But some patients, you know, I don't think she would have benefited from being asleep, but she just had a fun reaction. She was very ticklish. And
Oh,
so
God.
the worst case scenario, you're like, this is tickling me. And I'm just like, okay, you know.
Yeah.
But we take our time. Like I said, even with the medications and the cocktail that we use, some patients, we got to modify it. Everyone doesn't get the same thing either. We start with a base of what we give people, but sometimes people have different preferences or people's tolerance is different. And we do modify for each patient throughout the procedure.
Okay.
Okay. And as far as awake lipo versus traditional lipo, what are the differences when it comes to the healing process?
Honestly, I would say it's really going to be recovery, meaning you have to go to the PACU and recover your lungs more so. The surgical procedure itself shouldn't differ. Now, what I will say, most people, if they're going to get the liposuctions where they're put to sleep, they're probably getting a more invasive procedure, which means they're probably doing a tummy tuck with it, maybe some hernia repairs, maybe also breast. So you're going to want to go to sleep with those big procedures. But if you're just thinking of just doing liposuction and no other big incisions are part of your procedure, I would definitely recommend awake because your recovery will be better.
And what does your ideal candidate look like?
I don't have an ideal candidate. You know what? No, I do. My ideal candidate is someone who has a good understanding of what's going to take in the post-op
Come on now.
period. I am doing 10%.
That's it.
10%. And I have had patients who come in and they really just think this 3 hours with me is going to just
That's it.
change their life.
Oh my God.
And I
Okay.
tell them, I mean,
Speak it.
and that's why I do consultation on all my patients myself, because I want to understand, number one, what we're starting at as far as what your goals are, what your baseline and your lifestyle are, what it looks like for work for you, kids at home, your support system, your activity level, your diet. And then we talk about those things. So even after surgery, all right, okay, the first 30 days up, now what we doing? Are we, you said you was going to do this. Are we doing it? I have had patients text me their calorie burn, their workouts. Oh yeah, I get on some people. I've had patients that were non-compliant, thought they could go to Vegas the next week, didn't get massages and come back, and I'm like,
Listen, talk about
Or
it.
work
what are we
2 days
doing?
later.
or thought they could go, and you're a nurse and you thought you're gonna be in the ICU next.
Nah, I said
Why-
this on our last part. Nurses are the worst.
Let me
We
tell
the
you.
worst.
Let me tell you. I had picked up a shift.
I'm like,
We are.
so. And you're like, well, I didn't want to wear it because I was at work. I'm like,
No.
I t-
No.
we talked about this.
We the worst. We are.
Well, healthcare workers are the worst. I'm gonna tell you.
we are.
Yeah. We don't listen. We know everything and don't listen at all.
Mhm.
Yeah.
Sound like me at my doctor. But no, my ideal candidate is someone who understands what it takes and someone who deserves, especially, and I do men, but women, mothers, you've worked hard, you've taken care of other people. You're at a point in your life where you just want to get that confidence back, put on something that, and you don't have to worry about how you feel. That confidence is back. And it's going to motivate you to go work out. You're not going to be, a little bit more self-conscious when you go to the gym and you want to wear that sports bra and you have all these layers. People don't think about that feeling of even trying to go work out and how you feel in the back of a class. So I just want to make sure that I'm targeting people that, number one, want to get this done for them, and they're going to understand what it takes to maintain their new body. Because what are you going to take care of better? Old Honda, 97 Honda Accord, or that new 2024
Or that
Benz
new
truck
Benz truck
that you're pulling off the lot? You're going to take that to the car wash every day.
Right.
You're going to get the tune up, the oil change. So that's how I kind of look at it. It's really just investing into yourself and understanding what it takes to maintain the new body that we're building together.
Okay. Do you have any BMI requirements?
I do not.
Really?
So that's one of the other things I think I offered a little differently. Because I came from the bariatric world, I'm not scared of bigger patients. Now, some people are just too unhealthy to do certain things, and that's just whether they were going to get gastric bypass. We make them sometimes have to lose weight just because you need to lay back in certain positions. If your airway is compromised, if it's not going to be beneficial to you, no, I'm not going to lipo someone who's 600 pounds. Why?
Right.
What are we doing?
Right.
So-
right.
It's a drop in a bucket. But I have patients that are bigger And what we talk about are multi-stage procedures. We talk about maybe I'll do the front because we can only get 5 liters off in a session, right?
Right.
When you're too aggressive, when you don't follow the standards of care, that's when you get into trouble. And unfortunately, when people do go to these places overseas, that's what's really happening. They're not sticking to the standards of care. And you're trying to do too much. Even if someone wants to do arms and 360 and legs and BBLs, I'm not doing all that at the same time. Because number one, how you going to take care of yourself?
Right.
Yeah, you can't do anything. Like
And I don't think people understand that 5 liters is collectively.
And it's from your whole body.
It's from your whole body.
So what are our goals?
Yeah.
I'm not going to be able to hit the upper back 360. But it depends on who the person and what their goals are too.
Right.
If you want me to just smooth rolls out, we might be able to do all that. But so I talk to them, and that's what's also discussed in our consultations. But, even smaller patients, I've had patients that were turned away because they were told they need to gain weight for liposuction. No, you don't.
Right.
I've done very petite people, and they are ecstatic with their results because they still have fat. And you just don't think about where people may carry their fat. They may carry it more in their back or just that little lower abdomen patch. And that's what's really bothering them. So if that's what's bothering you, that's what we're going to target.
yes.
Absolutely.
What is your clearance process like?
I don't really do a full pre-op lab workup because we're not doing anything too invasive. Now, obviously, we do a full history and physical, and I do that myself. Every patient, I don't.
That is awesome.
You're not gonna meet me on the table. You're gonna meet me.
And
That's
that's
good.
big.
That's
That's a big call
important.
out because a lot of times you don't meet your doctor till the
You
day
get marked
of,
up.
right before surgery when you're getting marked up. And a lot of people don't like that. And a lot of situations could have been avoided had they met their doctor and went over all their paperwork and labs and stuff ahead of time.
Yes. So with that, I rule out people. Maybe you have a skin thing and it's not a lipo thing, or maybe you thought you were going to get this, and I'm like, no, you really just, and we talk about it together. So that's number one. Number two, your medical history is important. So depending on if they're on a lot of medications, obviously most people that want to go into this outpatient setting need to be baseline healthy. But if you have diabetes, you have hypertension, that does not rule you out. If they have recent lab work, I look at it, but it's not a requirement for me. I do a pregnancy screen. But other than that, I trust that my patients would tell me they're not smoking.
Yeah.
Because you have to sign that waiver.
Yes. Okay.
That's one of the biggest things people don't think about is that nicotine in smoking cigarettes will increase your risk of wound infections, poor wound healing, and it's a mess.
Yes.
I just had that conversation this morning. I told a client, I was like, she's like, she had went out the night before. I said, no hookah, no nicotine. I was like, not even the people around you. She was like, really? Because they were, no ma'am. None.
And that's one of the worst things they could do is it. And it's just, you're invested in this. Just heal, do the best thing for your results. And it all goes into what type of results do you want?
Right.
And I trust that you're going to tell me, but it's also signing the waiver. So that's one of the things to protect yourself and the patient and explain to them why. I'm not just saying no, because I can. It's just because it actually is going to have an effect on your outcomes.
Yeah. And I'm one of those people when it comes to explaining anything to any patient, I tell them the why because the why will prevent them from doing more harm to themselves.
Absolutely.
Because if you just say, hey, stop doing this, you're going to be like, okay.
Yeah.
Why?
That's what your kids ask.
Yeah.
Why?
Exactly. And that's how you have to look at it. Because assume that they know nothing. And that's where I start. Assume patients know nothing. It's your job to explain the why, the how, and the what. And the when, and the everything.
Everything else. Okay. Everything in between.
Absolutely.
So if someone was preparing for surgery, what would you recommend?
Don't do too much. Just, prepare your house. The main thing, prepare your bed for the leaking. You're going to leak. It's going to be a mess.
Yes.
We help you with your car when you come, but if you have carpet all the way through, let me know. I didn't know you had white carpet at home. I tell people, get an old dollar store shower curtain liner. Lay that on your bed. You don't have to do too much. It's only for a couple of days you're going to drain. Make sure you have someone to take care of you.
Yes.
I do not. It's not an option.
Emphasize that enough.
Can't have an Uber pick you up. Can't have. I had.
A girl just asked that, no lie, on TikTok.
I mean, you have to tell people because you can't assume. It was a nurse. She knows better.
No, she knew better.
You know you would not.
Nah,
let your
I'm not
patient
that bad.
She
go
just
home.
wanted to do
I'm not that
something.
bad.
She
knew
said,
better.
I said, because she thought it was gonna pass because I think when she flew into town, it was her driver from that picked her from the airport. That's not your friend. You don't know him. He's just a repeat driver.
Oh my God.
My mouth was on the floor. I mean, but but making sure, I think the most important thing is making sure someone is there to care for you, and that's discussed way prior to who's going to care for you. The minimum is 6 hours, but I tell them I want someone to spend the night with you because that first time you go to the bathroom, that first time you shower, when you get it, you're going to want to fall if you don't fall on your face.
Yeah, most definitely.
So you're a fall risk, and you need to have someone care on you and love you, especially our high power alpha female type. I could do it all super women. Let someone love on you. Let someone be your caretaker. Allow yourself grace to heal. And I ask for just a couple days.
Right.
More is better.
Right.
But if you could just let someone just help you, there you go.
At least for the first 2 to 3
Yes,
days. Yeah.
absolutely.
It's a struggle.
Most definitely.
It is. Get into your garment
I think
the
people
first
think
time.
that because you're not in a hospital setting, they take things lightly. They think, oh, it can't be that serious. I saw a girl one time, she said, she was trying to encourage people not to use like nurses and
Post-op
stuff
care,
like that for
yes.
post-op care. She was like, I mean, how
on the
serious
surgery
can it
group.
be if they just going to release you? I mean, you don't even have to spend the night, so it's not that serious. You know how many girls have passed out, end up in the hospital,
Everybody.
Taking off
get
the fob.
infections.
Everybody.
I mean, come on, it is serious.
When you lay down for a little bit and sit up, you dizzy.
Yes.
So imagine getting 5 liters of
Right.
fluid, fat
Yeah.
out for you. You're draining. You're tired. You're on medications. And some of these girls, they've never had this procedure before. They don't know how these different medications are going to hit them.
Most definitely.
It's silly. And every single one of my patients recommended to get a actual in-house caretaker, preferably a nurse,
Right.
that comes to you that first day,
Right.
not the 3rd day, not the 6th day. Now, some people, the first week, no, day 1. That's it. That's my requirements.
Any vitamins or anything in particular that you suggest people take as well?
I love my overall health thing. I love collagen and I love biotin, but I don't really make those type of suggestions. I know I try to stay away from that. Everyone's a little different with their diet and their baseline, so I do individualize those recommendations
Okay,
for different
good.
patients.
Okay, awesome.
I do warn them that people out here selling, and so be careful.
Be very careful.
But it's a business, so people got to live. I just stay out the other side of that.
Right, okay.
When it comes to post-op care, how long do you recommend people keep on their garments?
Ooh, forever now. So my post-op course is really broken down in a 3-month process. The first month, the second month, and the third month, I follow up my patients first week, 30 days, 6 days, 90 days. I really do like to follow up with my patients. And you're still healing. Some patients are still even swollen at 3 months, and that's okay. By the time they get to that process, they love post-op garments. That is part of their new undergarment. That I've rarely had a patient that's like, whoo, it's 3 months, I'm never wearing this again. No, they like the support. You're an expert in it now. So I was wearing garments and I never had the surgery. So it's just something that people like. It's supportive. Just having that extra, if you maybe went on a trip, you ate a little too much, it kind of keeps you back in check. It does help your shape stay and maintain. So most of my patients, I tell them you can't wear your garment too much and you can't get too many massages. I have a minimum requirement, but you cannot miss out on those benefits with or without these procedures. There are benefits to the garments. There are benefits to the massages.
What is your minimum requirement for massages?
6.
Oh,
I
okay.
tell them 6, just because everyone's budget's a little bit different. But I
definitely.
rarely have a patient that just has gotten 6.
Okay.
And 3 is in the first week, so
Right.
you do the math.
Right. Okay.
Like I'm like, but once again, you can't get too many massages. If your budget allows you to get 1 every day for the rest of your life, please do.
Right.
Elizabeth
Most
I had, a
Taylor.
client, I had a client like that. She came to me every day.
Yes. Some people
She
got it
did.
like that. I don't know their life, but they just like, I do it every day. And I'm like, that's amazing for you. But some people really have to stick in their budget, and that's okay. But for results wise, I'm happy with 6, but most people really require more than that, especially the first couple of months.
Yes.
Okay. And what do you think the difference is mainly when some girls say, oh, one doctor recommended a tummy tuck, one doctor recommended lipo. What do you normally kind of go with? What is your take on that?
I think it really depends on what the surgeon is comfortable with. Traditionally, you would look at anyone a few years ago and say they need a tummy tuck if they had a pannus, meaning skin hanging over. Um, Now, I have done so many patients with a large pannus where loose skin, twins, mothers of twins, where you would think the skin will never come in and it comes in. So I do believe that we can do these patients without needing to do the full tummy tuck. I mean, you have the risk of the wound infections, wound breakdown, dehiscence,
Right.
recovery. It's list goes on and on. And people are trying to get a cosmetic procedure. They want to be out here naked. Let's be honest.
Okay.
We outside.
1 week post-op. They need to be like ready to go.
They're already booking their trips to the beach.
Right.
Newsome and Sis are purchased.
Full quarter fashion
So what
over.
they don't want is Fashion Over like Dr. Dude. I need sponsorship.
I know, right?
But honestly, the goal is, even with my biggest incision is the tip of my pinky now. People are like, oh, where you going to put it? I'm like, okay, like in your bikini line and under your arm. People are worried about that. So most people, if you give them the option, they don't want the full incision. Now, there are some people that just have a lot of excess skin. And excess skin may come from massive weight loss, maybe had previous
Right.
bariatric surgery, or so you had massive weight loss and you just have skin where the fat is not the problem per se. And for those patients, you need a tummy tuck. You do need a skin excision, whether it's your arms, your belly, wherever that needs to be taken out. So I really do say it's really up to you talking to your doctor during your consultation and really discussing what plans work for you and see what your options are. Because there are people out here that really didn't need a tummy tuck, and I see them, they're like, oh, I should have came to you. I'm like, oh, I didn't know.
Right. Too late now.
I do the second round, and then they're happy.
Yeah.
I've done tons of people that have had previous incisions. They went down to, say, Miami.
Right. Oh, I'm guilty. Okay, I'm sorry.
We sorry, Dr. Didi.
I'm not trying to.
We didn't know you did. We didn't know you did.
know
You
you
didn't
did.
forgive
Look,
us.
I'm not. I was like, I don't know. That's just one of the places I see. Everyone automatically gets that tummy tuck. The BBLs are beautiful down there. I want to give them. I mean,
Thank you.
hands down to them. But a lot of those patients did not need that. And so I end up doing the revision, because when they do that, they also don't take the fat, because you need that for your blood supply.
And a lot of people don't
Talk about
understand that. And then
They don't.
They're like, they still got
Yes.
fat. So they have to get a 360 again.
yeah. So I've had clients where, and I tell them, if you have fat up here, it's not going to do anything but move down here. So you might want to lose weight first or try lipo and see how that works out for you before you go and have a tummy tuck.
Yeah. And that's, honestly, I think the medical weight loss, the slimming injections are great. They definitely are effective. They definitely work. I was using them years before they were FDA approved for our bariatric patients.
Oh, wow.
And there was a diabetic medication
Right,
before it was FDA approved for medical weight loss. So I know it works. I'm so happy I'm able to offer it to patients. And I don't care if they, use it before, during, or after. But when we're doing liposuction, we're targeting areas. So we're targeting specific areas where you want that fat removed, and we're sculpting. We're building out a shape that's already there. You already got that waistline. We're just carving it out. You already have that takeoff. That's what I call it in the back. We're just carving it out. So if overall weight loss is important for, number one, our health, but also aesthetically to be just adding to that confidence, I would do something like recommend weight loss as well. And then if you still have an area that's really, really bothering you, and if it's just the skin, maybe. But for most people, it's not.
Now, with the weight loss injections, do you suggest that people stop them a certain time before coming to you?
Nope.
Because that's one of the differences, I think, between
Yes.
staying awake and being put to sleep.
Yeah. They
It
tell
doesn't
you to
necessarily-
Yeah.
And I would say it's just because they give you so much stuff.
Right.
And honestly, there's cross reactivity with different medications that you get, and it's good to be on the less than more side. But for us, because we're not
Putting you to sleep.
yep,
Right.
and a lot of medications we use are going to be the same medications that you actually use for post-op. You're able to take all your medications as prescribed. A couple of medications I may look out for, but if you're taking your diabetic medication, you're taking your blood pressure medication, please take them as you would, because you're still going to be eating.
Right.
You're not going to be fasting. So I do not change most people's regimen.
Okay. Now, if someone has like a high A1C, what is like your cutoff? Like if your A1C is just this and
Like if it's like what what I've seen so many people that's sick. That nothing.
Really?
It doesn't scare me. What scares me is why are you just now finding out with me and not with your doctor? That's what we talk about.
Right.
And what are we going to do about it? Because at that point, slimming injections is not what we need to be
Right.
talking. We need to
We
get you
need
on some
to-
insulin.
yes.
Right.
We need to
Most
get you to a
definitely.
primary care doctor
Mhm.
and a specialist that deals with endocrine disease.
Mhm.
So that would be my recommendation to them
Mhm.
because you should be on something for that.
Most definitely.
We do screening and lab work for those patients as well because, like you said, some people don't even know
Right.
that they are diabetic or pre-diabetic. And that's a totally different issue. Not only are we targeting because it can treat it, we're tracking it, but we want to make sure we have a baseline of health.
Mhm.
It's cardioprotective as far as reducing your risk of heart attacks and strokes. If you do have diabetes or pre-diabetes, it actually can cure that, meaning bring those HbA1c numbers down. So I love that medication. And you can stay on it as long as you need to. It's not like those traditional weight loss medications like phentermine where you had a 3-month period because
Oh
it
my
increased
God.
your risk of heart attack.
Ooh, that
People
fits
walking
me.
around like little crackheads.
Yes. I went, listen, I did her massages, right? And I had phentermine. And I came over there, she's like, what's wrong with you? I'm like, I don't know.
You knew what it was.
Right.
But those were, they work, but you can only be on for 3 months. And it really
Yes.
takes about 3 months just to reset your metabolism, no matter what you do, whether it's medication, a new diet. If you think about like new year, new me, I'm a fast and I'm be cute. You lose 10 pounds in January. February, you do about half of that. By spring break, you done gain 25 pounds. That's because your metabolism did not have enough
Yes.
chance to reset.
Mhm.
So it's really important, no matter what you do, to do it for at least 3 months to reset your metabolism. So whether you're taking medication, you start a new regimen, and make sure it's something that you can maintain. So obviously, I'm into fitness. I'm a instructor.
Oh, we're getting into that. That's next.
We gotta go.
Okay.
So I'm really into like holistic health. So I really do talk to my patients about all of those things. So yes, you get a little nip tuck. It's cute,
Right.
but what are we going to do to maintain it? And that's we really
Yes.
delve into that too.